Which of the following are signs of acute kidney injury, aka? A. Decreased urine output. B. Hypertension. C. Hyperkalemia. D. Edema. E. Confusion. F. Nausea. The correct answer is A, C, and E. Acute kidney injury, AKI, is characterized by decreased urine output, oliguria or anuria, hyperkalemia, elevated serum potassium levels, and confusion, due to metabolic waste accumulation. Select all the interventions for a patient with a suspected stroke. A. Perform a neurological assessment. B. Administer tissue plasminogen activator, TPA. C. Monitor vital signs closely. D. Keep the patient NPO, nothing by mouth. E. Prepare for emergency surgery. F. Elevate the head of the bed. The correct answer is A, C, D, and F. Interventions for a suspected stroke include performing a thorough neurological assessment, monitoring vital signs closely for any changes, keeping the patient NPO to prevent aspiration in case of dysphagia, and elevating the head of the bed to promote cerebral perfusion. Which of the following are symptoms of heart failure exacerbation? A. Dyspnea. B. Bradycardia. C. Crackles in the lungs. D. Hypotension. E. Ascites. F. JVD, jugular venous distension. The correct answer is A, C, E, and F. Heart failure exacerbation may present with dyspnea, due to pulmonary congestion, crackles in the lungs, indicating fluid accumulation, ascites, fluid retention in the abdomen, and JVD, jugular venous distension, caused by elevated central venous pressure. Select all the nursing interventions for a patient with diabetic ketoacidosis, DKA. A. Administer insulin therapy. B. Monitor blood glucose levels frequently. C. Encourage increased fluid intake. D. Assess for signs of dehydration. E. Administer potassium supplements. F. Provide education on carbohydrate counting. The correct answer is A, B, D, and E. Nursing interventions for diabetic ketoacidosis, DKA, include administering insulin therapy to lower blood glucose levels, monitoring blood glucose levels frequently to assess treatment effectiveness, assessing for signs of dehydration and correcting fluid deficits, and administering potassium supplements to replace electrolyte losses. Which of the following are risk factors for developing pressure ulcers? A. Immobility. B. Poor nutrition. C. Moisture. D. Advanced age. E. Increased activity level. F. Obesity. The correct answer is A, B, and C. Risk factors for pressure ulcer development include immobility, leading to prolonged pressure on skin and tissues, poor nutrition, impairing tissue repair and maintenance, and moisture, increasing skin vulnerability to breakdown. Select all the signs and symptoms of hypothyroidism. A. Fatigue. B. Weight loss. C. Cold intolerance. D. Bradycardia. E. Constipation. F. Dry skin. The correct answer is A, C, E, and F. Hypothyroidism manifests with symptoms such as fatigue, due to decreased metabolic rate, cold intolerance, from reduced heat production, constipation, resulting from slowed gastrointestinal motility, and dry skin, due to decreased sweat and oil gland activity. What are common signs of dehydration in a patient? A. Increased urine output. B. Thirst. C. Hypotension. D. Poor skin turgor. E. Tachycardia. F. Confusion. The correct answer is B, D, and E. Signs of dehydration include thirst, as the body attempts to increase fluid intake, poor skin turgor, indicating decreased tissue hydration, and tachycardia, as the heart compensates for decreased blood volume. Select all the interventions for a patient experiencing an asthma exacerbation. A. Administer bronchodilators. B. Monitor oxygen saturation. C. Encourage deep breathing exercises. D. Administer corticosteroids. E. Place the patient in a supine position. F. Provide emotional support. The correct answer is A, B, and D. Interventions for an asthma exacerbation include administering bronchodilators to relieve bronchospasm, monitoring oxygen saturation to assess respiratory status, and administering corticosteroids to reduce airway inflammation. Which of the following are risk factors for falls in older adults? A. Impaired mobility. B. Poor lighting. C. Polypharmacy. D. Increased fluid intake. E. Protective footwear. F. Cognitive impairment. The correct answer is A, B, C, and F. Risk factors for falls in older adults include impaired mobility, due to muscle weakness or balance problems, poor lighting, increasing the risk of tripping or missteps, polypharmacy, causing side effects like dizziness or lightheadedness, and cognitive impairment, impairing judgment and coordination. Select all the signs and symptoms of opioid withdrawal. A. Hypertension. B. Diaphoresis. C. Dilated pupils. D. Nausea and vomiting. E. Rhinorrhea. F. Muscle cramps. The correct answer is B, C, D, E, and F. Signs and symptoms of opioid withdrawal include diaphoresis, sweating, dilated pupils, due to sympathetic nervous system activation, nausea and vomiting, rhinorrhea, runny nose, and muscle cramps, resulting from autonomic hyperactivity and gastrointestinal distress. Which of the following are potential complications of a blood transfusion? A. Hemolytic reaction. B. Septic shock. C. Hyperkalemia. D. Hypoglycemia. E. Allergic reaction. F. Hypertension. The correct answer is A, B, and E. Potential complications of a blood transfusion include hemolytic reaction due to mismatched blood types, septic shock from contaminated blood products, and allergic reaction to donor proteins or additives. Select all the signs and symptoms of meningitis. A. Headache. B. Mucorigidity. C. Photophobia. D. Bradycardia. E. Petechiae. F. Decreased bowel sounds. The correct answer is A, B, C, and E. Signs and symptoms of meningitis include headache, mucorigidity, neck stiffness, photophobia, sensitivity to light, and petechiae, tiny purple or red spots on the skin, due to meningococcal infection. Which of the following are common side effects of opioid analgesics? A. Constipation. B. Hypertension. C. Bradycardia. D. Sedation. E. Diarrhea. F. Respiratory depression. The correct answer is A, D, and F. Common side effects of opioid analgesics include constipation, due to decreased gastrointestinal motility, sedation, resulting from central nervous system depression, and respiratory depression, a potentially life-threatening complication. Select all the nursing interventions for a patient with a nasogastric NG tube. A. Verify tube placement before each feeding or medication administration. B. Check gastric residual volume every 4 hours. C. Flush the tube with 10 ml of sterile saline before and after medication administration. D. Secure the tube to the patient's nose with adhesive tape. E. Irrigate the tube with carbonated beverages to prevent clogging. F. Keep the patient in a supine position to prevent tube displacement. The correct answer is A, B, and C. Nursing interventions for a patient with an NG tube include verifying tube placement, checking gastric residual volume to assess feeding tolerance, and flushing the tube with sterile saline to maintain patency and prevent medication residue buildup. Which of the following are priority assessments for a patient experiencing anaphylaxis? A. Airway patency. B. Skin color and temperature. C. Blood pressure. D. Oxygen saturation. E. Bowel sounds. F. Urinary output. The correct answer is A, B, C, and D. Priority assessments for a patient in anaphylaxis include maintaining airway patency, assessing skin color and temperature for signs of circulatory compromise, monitoring blood pressure for hypotension, and measuring oxygen saturation to assess tissue perfusion. Select all the signs and symptoms of hypoglycemia. A. Shakiness. B. Hypertension. C. Diaphoresis. D. Hyperactivity. E. Confusion. F. Dry skin. The correct answer is A, C, and E. Signs and symptoms of hypoglycemia include shakiness, diaphoresis, sweating, and confusion due to decreased glucose availability to the brain. Which of the following are potential complications of a central venous catheter (CVC) insertion? A. Air embolism. B. Cardiac tamponade. C. Hyperglycemia. D. Peripheral neuropathy. E. Pneumothorax. F. Urinary retention. The correct answer is A, B, and E. Potential complications of central venous catheter (CVC) insertion include air embolism, from air entering the bloodstream, cardiac tamponade, due to fluid accumulation around the heart, and pneumothorax, lung collapse from inadvertent puncture of the pleura. Select all the nursing interventions for a patient with a tracheostomy. A. Monitor for signs of respiratory distress. B. Suction the tracheostomy tube as needed. C. Keep the tracheostomy cuff inflated at all times. D. Provide humidified oxygen as prescribed. E. Encourage the patient to speak with the cuff inflated. F. Change the tracheostomy dressing daily. The correct answer is A, B, and D. Nursing interventions for a patient with a tracheostomy include monitoring for signs of respiratory distress, suctioning the tracheostomy tube to maintain airway patency, and providing humidified oxygen to prevent mucous membrane drying and irritation. Which of the following are signs of potential complications in a postoperative patient? A. Increased pain. B. Erythema and warmth at the surgical site. C. Hypotension. D. Normal bowel sounds. E. Serosanguinous drainage on the dressing. F. Elevated temperature. The correct answer is A, B, and F. Signs of potential complications in a postoperative patient include increased pain, indicating inadequate pain management or surgical complications, erythema and warmth at the surgical site, suggesting infection, and elevated temperature, a sign of systemic inflammatory response or infection. Select all the nursing interventions for a patient with a seizure disorder. A. Protect the patient from injury during a seizure. B. Restrain the patient's limbs to prevent injury. C. Place the patient in a supine position during a seizure. D. Administer antiepileptic medications as prescribed. E. Document the seizure activity, including duration and characteristics. F. Provide oral fluids during a seizure to prevent dehydration. The correct answer is A, D, and E. Nursing interventions for a patient with a seizure disorder include protecting the patient from injury during a seizure, administering antiepileptic medications as prescribed to prevent seizure recurrence, and documenting seizure activity to monitor treatment effectiveness and guide care planning.